The language mirror. How a single sentence can shape a lifetime of pain. The most powerful treatment my patient had ever received was not an injection, not surgery, not even a failed therapy program. It was a sentence. She didn't remember it word for word, but she remembered what it meant, and meaning is what the nervous system keeps. The prescription as a story engine. Her referral read, "Physical therapy for mechanical diagnosis and treatment." To a clinician, that may sound neutral. To a nervous system that has lived in pain for years, it quietly translates into something else. Something is wrong with my structure, and it hasn't been fixed yet. That sentence alone narrows the entire universe of possible explanations. It does not invite curiosity, it declares a frame, and frames determine futures. Language is not descriptive in pain care, it is instructional. In chronic pain, language does not just inform, it teaches. Every phrase becomes part of the nervous system's training data. Wear and tear, degenerative, your spine is crumbling, bone on bone. There's nothing else left to do. Each one silently instructs the brain what to predict next. Danger, fragility, inevitability, and the brain, faithful student that it is, obeys. What we think we're saying versus what the nervous system learns. We often believe we're offering clarity, realism, honesty, or efficiency, but the nervous system hears threat, permanence, vulnerability, or collapse. We intend to explain the body, but we accidentally explain the future. Chart notes as identity scripts. At some point, patients stop saying, "I have pain." They start saying, "I have a bad back. I have degenerative hips. I am falling apart." Diagnosis migrates into identity, and identity is the hardest process to rehabilitate. Once someone believes their body is fundamentally damaged, every sensation is interpreted as confirmation. Even improvement feels suspicious. The quiet authority of medical language. A neighbor can say something alarming and it fades. A clinician can say the same words and they carry the weight of law. Medical language is not just heard, it is believed, and belief alters expectation, movement behavior, attention, pain intensity, and even recovery trajectory. Not symbolically, biologically. The unspoken lesson beneath mechanical. When we label pain as mechanical, patients often infer the problem lives in parts, not in systems. The solution lives outside of them. Their role is to comply, not to explore. Their body is an object to manage, not a process to engage. Agency slowly erodes, not because anyone took it, but because no one left room for it. The side effect, no one lists. Every medication comes with a warning. Every procedure lists risks, but language slips through without disclosure. We never say, "This explanation may cause fear." This framing may reduce movement confidence. This diagnosis may become part of how you see yourself for decades, and yet those are often the longest lasting side effects of all. A subtle ethical shift. We are trained to ask, is this explanation accurate? But in chronic pain, accuracy is not the only ethical metric. We must also ask, is this explanation helpful to adaptation? Truth without context can still wound, especially when the nervous system is already braced for danger. What changes when language changes? Something strange and quiet happens when clinicians shift their words, when degeneration becomes common age-related change seen in many people who are pain-free, when wear and tear becomes your joints are alive and adaptable, not eroding, when be careful becomes let's find what feels safe enough to rebuild trust. Fear does not disappear, but it loosens its grip, and the nervous system finally begins to collect a different kind of data. The mirror we rarely look into. We like to believe our power in pain care lives in our hands, but much of it lives in our sentences, in what we normalize, in what we dramatize, in what we declare permanent, in what we leave open. Language is the first treatment every patient receives, often long before they ever meet us, and it may be the last one they recover from. My patient did not become trapped by her arthritis. She became trapped by the story built around it, a story formed slowly, casually, by well-meaning professionals using ordinary words with extraordinary consequences. We rarely intend to limit people with our language, but intention does not spare impact. And in chronic pain, language may be the most potent and the most invisible intervention we deliver.